All right, everyone, welcome to the Flash webinar, 1 o'clock on the dot here. Let's give folks a few minutes to join. See people trickling in. We will go ahead and get started in just a minute. Looks like people are still joining. We do have a question already in the Q&A feature. Will the recording be available after the webinar? Yes, it will be available after the webinar. We will make sure to share it with all of the participants. All right, I will go ahead and get started here since we only have 29 minutes here and a lot to cover. Thank you for joining our Flash webinar on the CMS Health Tech Ecosystem Initiative. My name is Kristen McGovern. I am a partner at Sirona Strategies. If you are unfamiliar with Sirona, Sirona is a DC-based healthcare government affairs consulting firm. You see our, sort of the highlights of the services that we offer here on the slide. My background is in health tech policy. So I have worked in government in both the Office of Management and Budget and at HHS, at the Office of the National Coordinator for Health IT, as a senior person, chief of staff at ONC, working on health IT policy initiatives. And I have been in the private sector for almost 2 decades now, with a decade of those years being here at Sirona, leading health IT work when it comes to policy and regulatory. So I'm going to go ahead and dive right in. Again, this is a flash webinar. It's intended to be sort of a quick and dirty summary of notable developments in the policy space. We know everyone is very busy. We could spend, an hour plus on some of the details here, but we know that not everybody has that kind of time, and that many of you out there really just need sort of the high level framing on how to think about some of these announcements, as well as what the next steps will be. So welcome, inter flash webinars here. So today we are here to talk about the CMS Health Tech Ecosystem Initiative. Many of you, I think some of you probably found your way here from LinkedIn. There was a lot of LinkedIn activity on July 30th when the White House and CMS made the next wave of announcements related to this initiative. Part of what we will talk about here shortly are a series of voluntary commitments. And so there are many press releases and announcements and pictures and all kinds of posts about this most recent announcement. And so our job here today is to help you put this into context and sort of understand the substance of what was announced, what happens next, and how this fits in with the broader activities at HHS and CMS. So at a very high level, what to know about the announcements on July 30th. First is that July 30th was one in a series of announcements. Over the past 3 or 4 months, we have really seen CMS begin to telegraph and talk about their technology initiatives and technology priorities. So starting in May, CMS released a request for information on the health tech ecosystem. They followed that up with a listening session and several announcements about their own technology initiatives as a payer, with Medicare as a payer. And then, of course, we had a broader suite of impactful announcements on the 30th, which we will talk about in detail. So what does this all mean? CMS is committed to taking steps to improve the Medicare beneficiary experience, and they are providing a platform for the private sector to take additional action to advance health system interoperability. And we will talk about this in more detail. The last thing to note here, sort of as you think about this announcement and sort of develop a mental frame for what this all means, is that in many instances here, CMS is acting as a payer versus a regulator, which is different than how we have seen CMS act in the past. So CMS, as a large payer, has made several announcements around how they want beneficiaries to interact with them as a payer, what tools they want to make available to their beneficiaries and members as a payer, and then how they want to partner with those in the private sector who are aligned and moving forward to achieve certain goals. What we've seen in the past is CMS or other parts of HHS put out regulation that tries to drive market behavior in a certain direction. And what we are seeing here is a fundamentally different approach, with CMS providing a platform for the private sector to innovate and drive forward on its own, and then maybe with CMS coming behind with some policy or regulatory cleanup where there are barriers or opportunities to accelerate. And again, we will talk about this in more detail. So what's happened and what's upcoming? As I mentioned before, the July 30th announcements were one in a series of announcements that CMS has made. You can see them here on your screen. The line here down the middle really sort of is a dividing point from on the left what we've seen so far, and on the right at a high level what we are expecting to come in the future. So I mentioned that CMS released a health tech ecosystem RFI in May. They held a listening session at the Humphrey Building in person on June 3rd and announced several foundational efforts that CMS plans to take as a payer, which we will talk about in more detail. And then, of course, we had the July 30th White House announcement, which included more detail on those previously announced foundational efforts, but also CMS's expectations and initiatives in working with the private sector more broadly. As we will talk about shortly, some of those announcements that were made on July 30th with respect to the CMS interoperability framework and CMS's own efforts have some timelines attached to them. So we are expecting to see updates from CMS on some of their own initiatives by the end of this year, by the end of 2025. And we are expecting to see updates from the private sector in terms of implementation of the CMS interoperability framework no later than July 4th, 2026, but more likely we will get a progress report earlier than that, Q1 or Q2 of 2026. So that's sort of the way to think about sort of what's happened to date, and then when we might know more about how these announcements have catalyzed public-private partnerships. All right, so getting started. So as I mentioned, back in May, CMS released a request for information on the health tech ecosystem. This request for information was, had a short turnaround in terms of comment period, but nonetheless, over 1,300 comments were received. CMS asked a wide range of questions in terms of the health tech ecosystem, with a goal of better understanding how we can all really work together to achieve the potential of digital health technology, how CMS could implement policies to ease health data exchange and promote innovation, and how to encourage patient, caregiver, and provider engagement with digital health products. So the RFI was sectioned out into questions for specific parts of the healthcare ecosystem, including patients, providers, payers, vendors, and value-based care organizations. The questions ranged from sort of high-level visionary types of questions. So how are patients using digital tools today? How do patients want to use digital tools? How are providers working with their patients to encourage use of digital tools? All the way down to, what are the barriers that you see with implementation of specific health information exchange networks like TEFCA, or, how would you change the ASTP EHR certification program? So a very wide-ranging RFI. And as you might imagine, those 1,300 comments that were received, all sort of like all over the map in terms of the comments, depending on the commenter's perspective. And level of detail and expertise in terms of the existing regulatory structures. This RFI really provided the foundation for, what we see next in terms of the Making Health Tech Great Again announcements on July 30th. So, CMS put out this RFI, they took in the comments, they had a vision in mind for what they wanted to do on their own as a payer, but then also how they wanted to work with the private sector. And that's sort of what we've seen in the culmination of this Making Health Tech Great Again announcement at the White House. So the announcement made on July 30th had three parts, and we will talk about each of those parts in turn here. The first are the CMS foundational efforts. So I've mentioned this a few times, but these are things that CMS will be doing on its own with respect to its own payer infrastructure in terms of the Medicare.gov website, and the Plan Compare component of that website, the Blue Button Initiative, the Data at the Point of Care Initiative, and then other newer efforts around provider directory and trusted exchange, as well as digital identity. So that's sort of the things CMS will be doing on its own to improve its own operations. The second component of the Making Health Tech Great Again announcement was the CMS interoperability framework. That framework has two parts. The first part is a set of criteria for CMS aligned networks. We will talk about that in some detail shortly. The second part of the CMS interoperability framework is a set of expectations for health tech ecosystem stakeholders. We will talk about that in more detail as well, but you can imagine that this goes something along the lines of, we expect that providers would make access to electronic medical information available to patients when and where they need it. So this is sort of their expectations in terms of what different parts of the healthcare system need to bring to the table or need to bring to bear, to commit to do, to realize the vision of the interoperability framework. And then the third component of this Making Health Tech Great Again announcement are the voluntary pledges. There were a number of voluntary pledges made across the healthcare system, with private companies signing on to commit to specific pledges and aligning with groups of their peers or similarly situated or similarly interested companies across the buckets of stakeholder categories that you see here. So there is a pledge for data networks, there's a pledge for electronic health records, for providers, for different types of patient-facing apps, and then for payers. Before we dive into the details of each of those three sort of pieces of the recent announcement, it's important to put all of this into context. So I started out by saying that this is not inherently a policy and regulatory activity. But nonetheless, all of the private sector innovation envisioned by the Making Tech Great Again initiative does live within the context of the current policy and regulatory space. And as you see here, we're not going to go over these frameworks in any detail, but there are a number of different parts of HHS and parts of the federal government that are responsible for the regulations and authorities under which the entities that made pledges under the most recent opportunity, or that will be implementing the CMS interoperability framework, all of those entities sort of operate under these umbrella regulatory frameworks. So you have CMS that has put in place certain regulations for providers in terms of how they use health IT. You also have CMS putting in place regulations for things that payers need to do in terms of making information available through APIs and sharing information with other payers. Of course, you have the Office of Civil Rights at HHS implementing the HIPAA requirements, and you have ASTP ONC implementing the Certified Health IT program, which is the EHR side of things, the information blocking regulations, and then working with the Sequoia Project as the RCE to implement their own nationwide health information exchange through TEFCA. And then finally, because patient-facing apps and tools were part of this announcement, of course, FTC is implicated. Won't go into a ton of details here, but many of the patient-facing apps are under the regulatory jurisdiction of the FTC, because when an individual clicks to share their information with a third-party application, that takes that application and its associated data outside the HIPAA construct and moves it over into FTC jurisdiction. So a little bit of moving parts here as we think about sort of how this announcement fits into the regulatory construct here in terms of the health IT landscape. Okay, so going into the parts of the announcement that was made on July 30th. So the first part of the announcement made on July 30th was really on the things that CMS plans to do itself. What are CMS's priorities as a payer? As I mentioned, they previewed some of these things in a little bit less detail at the June 3rd listening session, but they have released more information as part of the July 30th announcements and really added to the list of things that they committed to doing. So you see here the list of things that CMS is committed to doing. First and foremost is to have an app store on Medicare.gov. So CMS intends to build out the Medicare.gov website in several ways. One is to modernize the digital identity proofing aspects associated with that website, but another is to host an app store on Medicare.gov. This app store would highlight for Medicare beneficiaries digital tools that are focused on prevention, chronic disease management, and care navigation. Some details on this still to come, but as outlined in the interoperability framework, there are a certain set of criteria that apps that want to be promoted or highlighted on Medicare.gov will need to meet. One of those is to participate in a CMS review process and also a discovery experience. So you could imagine there might be a way on Medicare.gov to search for chronic disease management tools or to search for diabetes prevention tools, and then you sort of pull up whatever apps have been approved to be on Medicare.gov for that specific condition. CMS does not currently, at least as far as I know, have a mechanism for vetting and approving apps. So this will be something that will be new. They will have to decide if they want to do it internally or do it through a vendor. They will also, as all of us in the private sector probably know, lots of consideration when it comes to posting, sharing about apps and, crossing your T's and dotting your I's with respect to whether you're endorsing a certain product or otherwise, becoming responsible for whatever happens with the app that you've served up to your beneficiaries. So CMS is probably thinking through all of those details, not only how to, vet and approve apps for the website, but also sort of what comes next if a patient uses the app in terms of, all of the, reimbursement and legal responsibilities that come along with that. CMS also announced that they will be enhancing Plan Finder. This is a tool that beneficiaries use to look up Medicare plans to enhance the beneficiary experience. Not a ton of details here, but you can imagine that CMS may want to make information about plans that are participating in CMS aligned networks available to beneficiaries. So we will look for more detail on that soon. They also announced with respect to Blue Button 2.0 that they will focus on accelerating data availability, so shortening the time frame from which claims data comes into CMS to which it is made available to developers to push out through their Blue Button 2.0 tools. They also plan to make FHIR-based digital insurance cards available as soon as this year. Several announcements here around data at the point of care and National Provider Directory. With respect to taking the data at the point of care pilot to scale, they will start with digital identity integration and provider directory validation. With respect to the provider directory, CMS confirmed what was, relatively obvious if you've been listening to anything CMS has been saying, but that they will be using a FHIR-based API approach for their national provider directory. It will not necessarily be a new network or a new directory, but it will enable apps to find existing provider networks, participants, and endpoints. And it will be launched in the near term, potentially by the end of this year, at least in some, maybe beta format. With respect to trusted exchange, we will talk a lot about this in detail as this is sort of the bedrock of the CMS interoperability framework. At the June 3rd listening session, they indicated that CMS would fully participate in trusted data exchange, but didn't say how. It is now obvious with the most recent announcements that they will participate in trusted data exchange through CMS aligned networks. We'll talk about what those are. And then I have already mentioned that CMS plans to add modern digital identity to Medicare.gov this year. All right, so the second piece of the July 30th announcements was the CMS interoperability framework. As mentioned before, the interoperability framework really has two parts. The first are the criteria for CMS aligned networks, and the second is a set of stakeholder expectations. So what does CMS expect stakeholders to do to realize the vision of the interoperability framework? With respect to the framework criteria, you see some of the detail here. So there are certain functionality that CMS expects that CMS aligned networks would have in order to be designated as CMS aligned networks. And they go into some detail in these categories in terms of what that should look like. So, for example, under provider access and delegation, they expect CMS aligned networks to give full treatment access and to support a delegated model. They also anticipate or expect that providers, value-based care organizations, and potentially other stakeholders may be able to query CMS aligned networks to open quality, to identify quality gaps, for example. There are also other examples of things that they're expected to do. So they must be able to accept digital credentials. They must be able to enable app access with no special effort or extra logins. There are a number of requirements around returning structured and unstructured data into machine and human readable formats through FHIR APIs and other mechanisms. And also notably CMS in terms of data availability and standards compliance, they're focusing not just on clinical information, but also on data that has been considered administrative. So appointment details and notifications, for example. So these CMS aligned networks will need to consume not just the information that's included in sort of the traditional medical record, but will also need to integrate potentially with other systems like scheduling systems and other administrative systems that where some of this appointment information lives. CMS does expect by Q1 of 2026 to be able to showcase progress to date. So they are, hoping to be able to give an update on progress towards becoming, data networks becoming a CMS aligned networks, to providers and EHRs connecting to those networks along with payers, and then for patient-facing apps, examples of patient-facing apps leveraging CMS aligned networks. I do see we have a couple key questions here. Q1 2026 is calendar year, so that would be next year. And what is the definition of a CMS aligned network? So the definition of a CMS aligned network is a network that attests that it meets the criteria in the interoperability framework. So I just, we have this slide here that talks about it at a high level, but the CMS interoperability framework outlines a number of really technical criteria or, functional criteria that CMS aligned networks will need to be able to do. And those networks will attest that they can do those things. And then, then they would become a CMS aligned network. And CMS, at least sort of reading between the lines here in the framework, CMS intends to make a registry or a list of CMS aligned networks available at some point in the future. Okay, another question. Is there any requirement for providers to connect, or at this point, is it just a hope and expectation? At this point, there is no requirement. So going back to what I said at the beginning, this is not a regulatory exercise. There is no mandate. There is no, no policy incentive. This, at least right now, is not a policy exercise. Now, I imagine the person asking this question is aware that there are promoting interoperability requirements for providers, and that there is a health information exchange promoting interoperability requirement, along with several ways that criteria or requirement can be met. So you can meet that criteria by participating in TAFCA, you can meet it by participating in a state-based exchange, etc. For 2026, CMS has not proposed to add CMS aligned networks to that list because, of course, there are no CMS aligned networks yet. But that is something that you could see in the future in terms of, really embedding, once these network gets up and running, really embedding CMS aligned networks into some of those criteria. Okay, let's see here. Another question. Would a network consist of payers or providers or both? It could consist of payers or providers or both, is the answer. So the network, and maybe I'll move on to some of the pledges, but there are a number of entities that signed on to a pledge. Those entities, there were a category of data networks. Those networks now will be deciding what their aligned network is going to look like and who their partners will be. Some of those entities may choose all provider networks, some may choose all payer partners, some may choose both. And so we will see some variation here, I think, in terms of what the aligned networks look like. All right, I'm going fast. I'm going to go to the next slide here. This is really the second part of the CMS interoperability framework, which are the expectations by entity type. So you can see here, these are sort of aspirational things that these entities will need to do to make the CMS vision come to life. So data networks, of course, will have to implement the CMS interoperability framework. They will need to respond to requests using the interoperability framework, and they will need to self-attest that they meet all of the criteria they agree to be reviewed. Providers would need to join CMS-aligned networks. Payers would need to make claims data accessible to CMS-aligned networks. EHRs would need to make data available to CMS-aligned networks, along with other things, as you can see here. And so this is sort of, in order to achieve the vision, we will need all parts of the healthcare system to participate. And I think, CMS through the pledges, which we'll move to now, here really, has a core group of early adopters that they believe can work together in some capacity to realize this vision. You can see here, there's lots of words on this slide. We will be making the slides available after this webinar, but you can see here that, each of these categories of stakeholders took a slightly different pledge, but all have pledged to either become a CMS-aligned network, to participate in a CMS-aligned network, to connect to an aligned network. Lots of variations here depending on sort of where you're sitting in the ecosystem. But the goal is to ensure that more information is flowing throughout the healthcare system, and to have digital tools at the table to enable and support some of that information exchange. So you see here, we haven't talked as much about it here, but there are 3 categories of patient-facing apps that are included in this ecosystem. One is diabetes and obesity prevention and management tools. A second is sort of a group of tools to kill the clipboard. So this is a sort of a Karen Alliance initiative around, making sure that patients don't have to use clipboards to write in their medical information all the time, every doctor's appointment that they go to, and making sure that patient information sort of seamlessly follows the patient, and that there are more modern tools to use to intake some of that information. And then, of course, there is a bucket of patient-facing apps here around conversational AI assistance. So this is sort of, assisting AI tools that can assist patients in their medical journey. Okay, so what happens next? And then I know we have a bunch of questions in the chat that I will try to answer. So in short, the answer is everyone gets to work. As I mentioned several times, this is not, like we're not going to sit and wait for regs or mandates and then comment on those proposals and then have a few years until those requirements go into effect. CMS through this initiative is really trying to catalyze private sector market leading action. So CMS for its part will get to work, is at work to achieve their Q4 and Q1 milestones, including early iterations on the provider directory, modern digital ID, and standing up the App Store. For its part, the private sector, those early adopters, will get to work. So they've now made public pledges. Some of those pledges will require new product or technical plans or strategic pivots potentially, and they will also require partnerships. So those entities that took the pledge will be thinking, how do I become a CMS aligned network, or if they're one of those data network pledges, or how do I connect? What new relationships do I need? How can I, how will different networks do different things? So there's a lot of product development and partnership work to occur amongst those early adopters. And then finally, maybe the tip of the spear here in terms of the policy space, as the public and private sector start to work together, they will identify areas where maybe the standards aren't mature, and there is some, technical work that needs to happen, or maybe there's a policy barrier or something that could happen in the policy space that would be an accelerant. Sort of those types of things will bubble up to the top, and CMS will consider whether and how it needs to make new policy or make new regulation to address some of those issues. All right, I am going to turn, I know it's speed talking here, we're at time. Those of you who can stay for an extra minute, I will try to answer some of these Q&A questions. So what's my sense of the process by which detailed technical standards consistent with the principles would be created? I don't know yet. I don't think that CMS knows. I think the next step in the process before sort of figuring out how to develop additional technical standards is to identify where those standards are too immature or need to be developed. And then I would imagine that CMS will work with the private sector, potentially through some of the existing forums like HL7 or otherwise, to convene and develop guidance. Okay, how are these deadlines different than 21st century cures as it relates to interoperability? These deadlines are totally separate from 21st century cures. So the 21st century cures deadlines are regulatory in nature, and these deadlines are really tied to product build. I mean, how fast do they think that they can, that CMS can build some of the functionality into their products, and how fast do they think that the private sector can come together to make some initial progress? So the deadlines are totally separate from the 21st century cures deadlines. On the standards side, noting that the IGs would be determined in collaborating with the early adopters. Does this imply a CMS aligned network specific IG separate from the existing prior US core IG? I don't think it implies that. I think that when they said that they would work with the early adopters, I think they meant to sort of surface where additional standards and work might be needed. But I don't know that this implies that there will be something separate. Of course, that could be an outcome, but I don't know that they've already determined that. Okay, so another question. In the future, participation in this initiative could be required instead of voluntary. I do not mean to imply that I think there's any mandates coming down the pike. I think this question is with respect to the promoting interoperability requirements. So as currently structured, promoting interoperability allows you to meet the health exchange criteria through a number of different exchange options. I think that will continue to be the case. And I think if anything, CMS aligned networks could become one option here, not necessarily the mandated option. Do I expect that enforcing standards for CMS aligned networks would require promulgating regulations? I do not. I think that some of this will be self-policing. I do not expect it to require regulations, just like many private sector partnerships and arrangements don't require regulation to operate. Data security requirements or monitoring. There is a set of criteria related to data security included in the interoperability framework. So I encourage you to look at that section if that's something you're interested in. We will be, I think I've made it to the end of the questions. We will be sharing a recording of the webinar. The slides will be available. Last slide here. Of course, I'm always available. If you have any questions, you can reach out to me on LinkedIn or call me, email me. We will be monitoring private sector activity and CMS activity here, and as appropriate, we'll schedule additional flash webinars or make additional information available through our LinkedIn or other channels. So thank you for hanging in here for the quick and dirty version of the information here. Again, please reach out if you have any questions. Hope you found this informative and interesting, and look forward to connecting on this in the future. Thanks.